So, Michael, what is it about? What is unification all about, and why are we looking to unify?
Unification of purpose, clarity of purpose, and speaking with one voice has become increasingly important. It's become increasingly important for lots of reasons. One, that when the CFA started, there were relatively few special interest groups. I'm now a member of many special interest groups within my own profession, and there is a large amount of information available across a whole range of issues, all competing for attention and all competing for the public purse. And what we believe and what we've been told by the department is that in order to speak with a greater sense of purpose and knowledge and to be taken more or paid more attention to, we need to unify our voice and we need to achieve, and it's really a matter of together we achieve. So it's being able to say to people, we represent a national vision, a national view around best managed continence and bladder and bowel controlled health issues across Australia.
If you had to summarise the main benefits of unification, what would they be?
I think it's national. I think it's government and national reach. I think it's cost effectiveness and efficiency. I think it's probably avoiding duplication of effort and modernising our constitution and our governance systems to get best possible outcomes.
And you mentioned before about the history of the way the foundation began with the state bodies. Will the state-based activities and local programs still be continuing?
At the end of the day, I think that's critical. And indeed, in a time of COVID, none of us appreciated COVID when we started this process, but in a time of COVID, it's even more important that we have local activities and we have state-based facilities. We need the energy of the state, we need the engagement of the state, we need the understanding of the local needs and health needs of our consumers, and also the educational needs of our professional constituents.
So with unification coming up, as a member, what would I need to do?
You need to vote at your state AGM, and you then need to vote at a national AGM in order to have this pass. The most important thing, and the thing that would concern probably everybody, is to make sure we don't lose the benefit and engagement of our membership. We need to be clear about why we're doing it, what the benefits we want, and we've also got to be aware of the risks. And we cannot afford to lose the enthusiasm, dynamism, engagement of people who have contributed for so long in the past and people who should be and need to be engaged in the future.
Finally, can I ask what you might personally hope to see in the future of a unified Continence Foundation?
What I'm hoping for is that we continue to lead the world in better management, better policy, better research, better practice around continence. And therefore, I'm even more aware of how much we need to develop good services, good public policy, good systems and good education to support our professionals, to support our consumers, and to enable the government to bring out sensible practice and policy.